Alrighty, so we have a third part for mental health because I think that this information is just that important. I did not want to cut this particular chapter short because of the plethora of individuals who are struggling with mental illness in the United States. Okay. Now we come on to anxiety disorders, and we classify these as GAD, G-A-D, generalized anxiety disorders. We also include phobias, panic disorders, OCD, of which I got a little case too. All my stuff is lined up perfectly in my medicine cabinet or my pantry. Post-traumatic stress disorder. You have more than likely heard about this. This is not limited to individuals who have been participants in combat, but any sort of traumatic experience can lead to PTSD, including childbirth, because some women find that a traumatic experience, especially if it was painful or if they had a very tough delivery. And then all these types of things can lead to PTSD. There we go. And now for the Table 12.3, it just lists some of the symptoms, side effects of having anxiety disorders. The treatment for these are the same as they are for anything else, all of our mental health issues. It's going to be a combination generally of medicines, antidepressants, anti-anxiety medications, so just medicines, and psychotherapy. They call it cognitive behavioral therapy. It's still therapy. It's just a fancy new word that they're using for this versus schizophrenia. So a combination of therapy and medicine is generally how anxiety disorders are treated. It's pretty much the same for all of the mental health disorders, with the exception if you have severe cases. Sometimes they do shock therapy, but it's not really used in nearly the numbers that it was back in the 1950s, 60s, and 70s, where they just classified people as crazy, and there wasn't as much that they knew about mental disorders as they do now. When we look at treating mood disorders and anxiety disorders, one of the things that is very stressful with psychologists and with those who suffer is that these types of illnesses take a long time to recover from and to get help from. It is hard. If you've ever lived with someone who has had OCD or PTSD or anxiety or what's the other one, ADHD, or any sort of depressive disorder, you know that it is a chronic disorder. It's not something that comes and then it heals up quickly and then it can go away. These types of things can last for months and years at a time. Some people suffer with depression and mental illnesses their entire life. They're just medicated their entire life. So these things take time. And the medications, psychotherapy, the combination, generally speaking, both will be prescribed to you because in combination, you're going to see greater results. While it's totally possible, some people don't like to be medicated. Some people are against the stigma already of going to a shrink, but these shrinks can be very, very helpful in helping to dispel stereotypes and also helping you to get the help that you need. But in combination with the medication, you're going to see far greater results than one of the two on its own. Eating disorders. Bulimia, we talked about a little bit. Anorexia. These are the ones where women suffer almost 10 times as great as men do, partially because of social stigmas and social media that give us unrealistic viewpoints about how our bodies, hair, makeup, etc. should look. So anorexia is essentially starving your body of food, depriving your body of food, and losing 15% of your total body weight below that which is considered normal. And usually the BMI, or the body mass index, is what is going to be used for a depiction of what is normal weight. So 15% underneath that. Essentially, if you are under 16% or 16 for your BMI, and there's some wiggle room, it can be 16, 70%, but generally speaking about 15%, 18.5% for the BMI is going to be right at the cutoff for being underweight, and then anything under that is considered underweight. We know that there are some wiggle rooms for some people who are just small, but generally speaking, if you're looking at about 15, 16 on the BMI scale, you're going to be considered far underweight. Some of our symptoms we have: not being able to maintain weight, having a fear of gaining weight, distorted body image. I know people don't even have anorexia that suffer from this. And then the absence of 3 consecutive menstrual periods. Now, some of these things happen on their own with the cessation of the menstrual period. That can happen from menopause. That can happen if you're an athlete. Not necessarily in and of itself an indicator, but a combination of the symptoms. Now, when anorexic and bulimics go into treatment centers, they make these women and gentlemen, they make them get on the scale backwards, because it doesn't matter what the scale will say. They could weigh in at 80 pounds, 75 pounds, and they're still going to think it's too much. So they actually get on the scale backwards so that they don't see what the numbers are. Bulimia. So bulimia is kind of the opposite, but it has some aspects of anorexia, and commonly anorexia and bulimia are found together. Bulimia is characterized by purging, binging and purging. So you'll eat, but you're going to basically not keep the food down. And this happens repeatedly. Recurrent episodes of binging and vomiting. So not once or twice. A feeling of loss of control. And that's something that's scary for those of us who don't even suffer from eating disorders. Purging after a binge, and just like anorexia, having extreme concern and attention paid to how much you weigh, what your body shape is, what you're putting into your body, even though it's unhealthy. So they're very concerned about the way that they look. And with bulimia, with anorexia and bulimia really, but with bulimia specifically, these are some of the symptoms that you'll find, and you need at least 3 of them. So some of these things, I like to eat while I'm alone sometimes too. Sometimes I eat beyond the point of comfort because I just want to eat the whole tub of Haagen-Dazs. It's more than one of these issues. It's a combination of at least 3 of these. Now, if you have 2, that doesn't necessarily mean that you're in the safe zone either. So we look at behaviors because some behaviors can actually lead to others. They're progressive. But 3 of these behaviors are going to be characterized as having a binge eating disorder. What can we do? Same thing that we do for everything else: psychotherapy, medication, and family therapy, because the depression generally accompanies anorexia and bulimia, which are found together. So you really have a combination of 3 different mental illnesses: bulimia, anorexia, and depression. And there can also be some other issues going on, OCD. It's a variety of issues, and that's why there's a multi-tiered approach for treatment for all of our mental disorders. And now we come to some of our personality disorders. There are so many, so many. Passive aggressiveness. We all know someone who's a passive aggressive individual, and we probably can't stand that person. Hopefully it's not you. We all know people who are OCD, people who are paranoid, and then they have paranoid schizophrenics. We have individuals who are dependent. They can't do anything without another individual. I knew a girl that kept moving across the country to be with her sister, and her sister was married with kids, and this woman would just move and follow her sister all over the United States 5 and 6 times. So dependency. People who avoid other people, they're antisocial. Then we have people who are narcissistic, and this is my pet peeve, is the narcissism, because narcissism, according to some psychologists and psychiatrists, is just untreatable. These are the nastiest people. Oh, don't even get me started, okay? Because I can go all day on a narcissist. My foster mother is the most narcissistic, manipulative individual that I have ever met in my entire life. And she doesn't think there's anything wrong with her. And she got multiple aspects on these personality disorders, like a whole family of personality disorders for her. And she works in the medical community. So this is someone who has just gotten progressively worse over the years. And this is one of the reasons why some psychologists don't think that narcissism can actually be treated, because in order to solve a problem, you kind of have to admit that there is one. And so we all know people that can touch on a couple of these. Hopefully, if you are suffering from any of these, then you will be able to get some of the resources. And I'm going to give you a resource at the end of this presentation, and also continue to refer you to our student health center, where they have psychologists that are available for you to talk to through multiple sessions. Schizophrenia. This is characterized by psychosis. It's a severe mental disorder. The medications for schizophrenia are extreme. Women, men and women are about equally affected. There are multiple different types, paranoid, schizophrenic, there's psychosis. Sometimes they're combined. Some of the symptoms include hallucinations, delusions, just completely abnormal thinking, inability to really have good social skills with other people, inappropriate actions where they should not be. And of course, treatments are medication and psychotherapy. It really does stay the same for all of these. With our dissociative disorders, these are people that this one is a tough one for some individuals to deal with, because unconsciously it's really a way for you to kind of protect yourself from something that probably is an unrealistic depiction of something that's causing you stress, or emotional trauma, or you want to get away from everybody else. Maybe you just like being alone. But there are multiple types, and sometimes things such as amnesia, which we hear about, but none of us really know too many people that have had that. Those are still dissociative disorders, because the brain is trying to protect you from remembering or from reacting poorly to an event that was very traumatic. So sometimes they're actually accompanied by PTSD. And then we come to suicide. Unfortunately, I remember going back to our reproductive and our adolescent health unit, we talked about how suicide and homicide were on the list of the top killers for young women and girls. And here we talk about it again. These are some of your risk factors. Incarceration is at the bottom. I think it should be at the top, because it's hard for people to get a job when they come out because they have a record. And if they can't get a job, they go back to doing illegal things and they get arrested again. And then there's a cyclical effect that is just non-productive for society. And when you get to a feeling of hopelessness, then people can commit suicide. And we see that even with celebrities. Just having all the money in the world doesn't solve problems. Family history, mental disorders, prior suicides, attempts. And this is a short list, guys. Like I said, it looks different on many different people. It's not an inclusive list of everything. There's not a one size fits all approach to suicide. Quick story. And while I'm telling that story, go ahead and if you need to, jot down this National Suicide Prevention Helpline, where if you have urges or thoughts, you can get immediate help. It's open 24 hours a day, 7 days a week. And so the story I'm telling you about I'm going to tell you about is an individual who I was fairly close to. And this individual had a friend who told a group of friends, two gentlemen, told his gentleman friends, man, I feel like I'm going to kill myself. And while it was said in somewhat of a jest, generally speaking, when somebody talks about hurting themselves or killing themselves, they're telling the truth. And so, of course, because men are macho, or some of them are, they just said, oh man, you're okay, John. That was, it's assuading him. And he actually ended up shooting himself in his bathroom a couple of days later, and his fiance found him. It was completely traumatic, obviously, and I'm sure that the people whom he confided in said, hey man, I think I'm going to kill myself. I feel like I want to shoot myself. I can't imagine the guilt that they may feel, because they potentially could have had some sort of reactionary benefit to him. No, we don't know, but that is what happened. And so when people talk about suicide, they're going through something. They really need support. Don't brush it off. It's really important. They are going to need that support, even if it is just to make it through the next day. Make sure that you are there for them, that you give them your support. And then just finally wrapping things up, informed decision making. These are some ways that you can cope with stress. Exercise is great. Praying works for some people. Gardening, I personally never got into it because I'm not good at it. Animals are wonderful. Therapy animals are a huge aspect to therapy for men and women, massages, cracking jokes, all that stuff. This is, again, not an inclusive list. So I hope that you have found something beneficial from this presentation, and any questions, feel free to email me.